Psychedelics are substances that, when ingested, create an alternative state of consciousness in which the user experiences auditory and visual hallucinations. Examples of such substances are LSD, magic mushrooms, and DMT. These drugs are serotonin receptor agonists. They emulate the effects of serotonin, a highly influential chemical that contributes to the feelings of happiness, regulates mood, appetite, and sleep, and plays a role in cognitive functions such as memory and learning. Since serotonin is so important to human functioning, careless alterations in its levels can lead to highly negative effects on human well-being. This high potential for adverse effects is exactly why psychedelics are currently illegal under the UN Convention on Psychotropic Substances and are classified as Schedule I substances, drugs with no known medical use, by the U.S. Drug Enforcement Agency. However, psychedelics have recently been shown to have a medical use in the treatment of psychological disorders. Nevertheless, this finding is not grounds for denying the dangerous nature of these drugs. Psychedelics have a high potential for abuse and need to be tightly controlled. Not only should psychedelics be prohibited for recreational use, but they should also be prohibited for medical use. There are several factors that support this conclusion. Firstly, unlike common medications such as painkillers, psychedelics have highly variable effects. Two different people can react very differently to the same dosage of the same psychedelic. One person can have the best of experiences with a psychedelic, but another may experience the worst trip possible with the same drug. Since the effects of psychedelics are highly dependent on individual genetics, it is very difficult for doctors to prescribe a proper dosage to someone without adversely affecting their well-being. This argument applies even more so to clinical testing. Studying these drugs would require human trials with varying dosages and purities. It is possible that a person would be negatively affected by these trials and experience a bad trip. Common parlance for describing the nightmarish auditory and visual hallucinations people may experience under the effects of psychedelics. In addition to these hallucinations, people can experience severe anxiety, panic attacks, paranoia, mood swings, feelings of detachment from one's mind and body, a loss of sense of reality, and suicidal thoughts. Under prolonged use, people can develop disorders such as hallucinogen persisting perception disorder, a condition where a person will continue to experience sensory disturbances similar to those experienced while taking the hallucinogen for the rest of their life. These primarily include visual disturbances such as seeing flecks of light in dark spaces, seeing auras, visual snow, or trouble distinguishing colors. Such experiences can be traumatic to the point of permanent psychological damage. These effects are highly evident in the case of Daniel Barra, who, after consuming a large amount of psilocybin mushrooms in 2010, proceeded to burglarize a home as a result of his hallucinations. During his confrontation with the police, Barra developed a state of agitated delirium, a condition that presents with high blood pressure, high body temperature, profuse sweating, and psychiatric delirium. He soon suffered respiratory collapse from this condition and died. While such cases are not common, it is definitely true that any psychedelic can cause a reaction as extreme as Barra's, especially in a recreational setting. This leads to another reason why legalizing the medical use of psychedelics is very dangerous. It is a well-known fact that legalization of drugs for medical use also increases recreational use. This phenomenon was most recently seen with the legalization of marijuana for medical use in some states. Upon medical legalization in those states, recreational use skyrocketed since the market supply increased. It became extremely easy for someone without a medical license to obtain marijuana, as easy as presenting symptoms to a doctor to obtain a prescription. It therefore stands to reason that if psychedelics were legalized for medical use, recreational use would also increase. And if Barra's case is any indicator, any increase in recreational use would have highly negative effects on people and society in general. Moreover, marijuana legalization itself was correlated with an uptick in the ease of procuring psychedelics, amphetamines, and barbiturates. Then, if psychedelics were legalized, the same trend would occur, and even harder drugs such as psychedelic designer drugs would become more easily procurable. These chemicals are created to mimic the effects of psychedelics at a very cheap cost, but are significantly more dangerous. One such chemical is 25I-NBOMe, a substance that has similar effects to LSD at low doses, but proves highly deadly at higher doses. This snowball effect is yet another reason why any legalization of psychedelic substances would have adverse effects on human well-being. At first, psychedelics seem like a promising solution to treat mental illness and addiction, but there are many harmful effects of psychedelics which far outweigh any potential benefits. Psychedelics can mess with a person's sense of reality, they can cause hallucinogen persisting perception disorder, or they can even lead to someone harming themselves or those around them. These substances contain multiple risks to test in a closed setting and prove especially dangerous to legalize.
Created using Powtoon.